We're here with Dr. Karen Cornell, a professor of small animal surgery at the College of Veterinary Medicine, and Joan Priddy Esquire, executive director for Project Safe. And they're here to talk to us about a really exciting collaboration between the College of Veterinary Medicine and Project Safe. How y'all doing?
Good, very well. Thanks for letting me know.
So the name of the program is Vets to Pets and People. Can you tell me a little bit about how it got started?
Yeah, it was kind of the perfect storm, to be honest. I have a friend who's a social worker who's involved in a program called The Link, which is about the link between animal abuse and domestic violence. And she was talking to me about the program at a meeting we were both attending at the same time that another friend of mine was participating in Dancing with the Stars, which is a benefit for Project Safe. And at the same time, a proposal or a request for proposal came out from the Scholarship and Engagement Group here on campus. Yes. And so we applied for funding and were able to establish this program to help house pets of victims of domestic violence when they enter the Project Safe shelter.
Okay, and before we go any further, Joan, can you explain to us what Project Safe is and what's it all about?
Project Safe is an Athens-based nonprofit. We're working to end domestic violence through crisis intervention, ongoing supportive services, systems change advocacy, and prevention education in the community.
Okay, so one of the interesting things about this collaboration is that I think you have demonstrated that there's a link between domestic violence and maybe animal cruelty. Is that correct? Am I correct in that?
Absolutely. On several different levels, actually. Animal cruelty can be a sign of future violence against people. It is one of the sociopathic triad that's often referred to when you think about serial killers. That along with bedwetting and setting fires. So it has that predictive factor. It can also be a tool that an abusive person uses to get and keep control over the victims. So demonstrating violence against the pets is a way of demonstrating power. The underlying message being, if you don't act right, I'll do this to you. Violence can also be a way to keep someone in a relationship. So if someone leaves the relationship, moves out of the home, and the pet is left behind, then a threat to harm the pet can be enough to bring the person back into the relationship.
So right now with the Vets to Pets and People program, how is that helping the victims of domestic violence?
Well, it's estimated in one of the published studies that 25% of women who enter a shelter would have entered sooner if they had had care for their pets. So what we've tried to do with Project Safe is that when they have someone who enters their shelter that has a pet, the vet school then will take the pet, and we have a foster network amongst our veterinary students. And so our veterinary students step up and foster that pet during the time that that person's in housing with Project Safe. On our end, it makes it so much easier and more efficient because we had tried through years through our own large network of volunteers to do pet fostering. But because the need is quite sporadic, and it is about, for us, it's about 20% of our sheltered clients have a pet that they're trying to figure out what to do with at the time that they call us. And so often we found that even if we had the volunteers in place, we couldn't reach them in the middle of the night or Saturday afternoon when someone was en route to the shelter. And so this gives us a single point of contact for our staff at any time to be able to get in touch with the vet school, bring the animal there. You all do the work then of finding the actual foster home. And if it takes a long time for us to stabilize the client, it might be a series of foster homes, correct?
And so how is that first contact made? Directly to Karen?
Yes, to myself and Dr. Kate Creevy. It's a combined effort between the two of us. We both wrote the grant that got the initial funding to get this started, and she's an integral part to the whole process.
So how is this program funded now?
The initial funding, as I said, was through this outreach grant, but now it's really funded through fundraisers that the students have put on. Our students have really engaged actively in it. We've done things from dunking booths to bake sales and that kind of thing to raise money to support this project. And we also have a significant amount of corporate sponsorship in the veterinary industry world that they provide product for these pets. When they enter care with us, we typically do a complete exam, provide heartworm testing, and then heartworm preventative and flea preventative and vaccinations, and in some instances even low-cost spay or neuter if that's required of the pet.
Have you noticed any effect on the animals themselves that have come into?
We've seen some effect on the animals, although most of those animals are quite well cared for by the person who's entering the shelter. What we have seen is actually an impact on our students. We've had several of our students. One of our students took a dog in, and he actually said he lost 10 pounds in the first 2 weeks that he owned the dog because they were exercising so much, because he wanted to get the dog out and they were running together and that kind of thing. So they really actually formed quite a bond with the pets as well.
And how is Project Safe funded?
Well, we're funded through a mix of state and federal grants. That's about half of our funding. And then the other half is from the local community. It's fundraisers like Dancing with Athens Stars and Groovy Nights. It's contributions from business and civic groups and churches and our thrift store revenue as well.
So is there any way that other veterinarians other than yourself and Kate or the public in general can become involved with Vets to Pets and People?
Absolutely. We are, a couple of different things I would say is we have, there's kind of two prongs to our project. Part of our project is obviously fostering the pets. The other is we really have developed an educational program where we've created brochures for both the general public to make the general public more aware of signs of animal abuse or domestic violence, and also specific brochures for veterinarians and veterinary practices so that they become more aware of that link between animal abuse and domestic violence. We've distributed those again through our students, and even the name of our organization was developed by our students. So it really is a student-driven process, and so as much as Dr. Creevy and I do a lot of it, the students really are the labor force behind all of our project. And so we've reached out to many veterinarians across the state. One of the students and I spoke at the GVMA conference, the Georgia Veterinary Medical Association. Our students manned a booth at the GVMA conference this year. And we've distributed brochures throughout the state for both clients and veterinarians.
Do you see this program spreading outside of the state of Georgia?
Well, interestingly, other states do have programs, and we actually have a survey out right now to evaluate how many veterinary colleges actually have a program that they run or they're affiliated with. We don't have all the data in yet, but I would say it's roughly going to be maybe 30 to 40% of schools have a knowledge of a program or are involved in a program. And there are other programs separate than veterinary colleges across the country.
You know, something that I was just thinking about, though, we've talked about the impact on the students, and we've talked about the impact on the pets and the care they receive, and on the victims of violence who come to us. We haven't talked about how this program affects children, which is something I think people don't really realize. But so many of the folks who come in with pets are people who have children, and very often those children are so burdened with worry about the safety of their moms and the safety of their pets. We had a little boy who was actually even suicidal because he felt that he had not done enough to protect his mom. And he was also very concerned about the safety of the dog. And providing this avenue where kids know that the pet is safe and they feel like they had some small part in making that happen, and they can continue to have contact and visits, we've been able to arrange that, really improves the emotional and mental well-being, not just of the adults, but the children and the family too.
You know, and this is such a wonderful thing for me to be able to talk about, is that I understand that Vets for Pets and People was named Advocate of the Year by the Domestic Violence Task Force of Athens-Clarke County and Oconee County. And congratulations, I think that's wonderful to both you and Kate.
It really is. And one of the things I want to emphasize is it's not just Dr. Creevy and I, and it's not just the students, but our hospital administration has been supremely supportive of the whole process. Frequently, as Joan said, we can't place them the day they come in, and our hospital has allowed us to have those dogs and cats in the hospital. And we obviously, the project funds their being there, but our whole staff is receptive to caring for those pets while they're in and until we get them fostered out. So it really has been a supportive effort of the hospital that makes it possible.
And I also understand that the program has also received another national award.
Yes, the Student AVMA, or American Veterinary Medical Association, just gave us a Public Service and Outreach Award at the American Veterinary Medical Association conference this summer.
Congratulations.
Yes, it's absolutely wonderful. Thank you so much, Joan. Thank you, Karen, for being on the show. And thank you for the service that you're doing to our community, both of you.